Hello, my name is Sofia Geiger, and this is my presentation on hydrocodone and acetaminophen, also known as Norco. So, what is Norco? Norco is the brand name for the drug combination hydrocodone and acetaminophen. This combination of these two drugs is classified as an opioid and it is used to relieve severe pain. This drug is by no means any doctor's first step in treating someone with pain. This is the solution when no other drug for pain is working or someone is in prolonged severe pain, like someone with severe back issues or someone with cancer. Hydrocodone is a part of a narcotic group, so it is classified purely as a pain medicine. It can be habit forming, so when taken for a long time, that is something that is risked. It could cause physical or mental dependence. And acetaminophen is commonly used as a pain reliever, but also used to reduce fever, so it does not have habit forming qualities, but it can still lead to liver damage if large doses are taken continually. The risk and consequences of taking Norco. It can lead to low cortisol levels, it can lead to headaches, drowsiness, which is why you're not supposed to operate heavy machinery when taking Norco. It can lead to mood swings. This means depression, anxiety, as well as mood swings. It can lead to nausea, stomach pain, other digestive issues. It can lead to slowed or stopped breathing, which is clearly extremely dangerous. It can lead to addiction or dependency, which I will touch on a little bit later. And if taken while pregnant, the baby can be born dependent on Norco, or it can immediately have withdrawal symptoms that are life-threatening. So the effects of Norco on the body. These effects can happen to someone whether or not they are abusing the medication or taking just as much as is prescribed and how the doctor is having them take it. It can lead to liver problems, narcotic bowel syndrome, kidney damage, respiratory issues, and addiction or dependency. And obviously the risk for these things is heightened if you are abusing or taking more than you are supposed to. Addiction or dependency consequences. You can have severe muscle and bone pain, withdrawal. You can be at a greater risk for pneumonia, and you can also overdose or have a seizure or coma from overdosing. These are just the effects it has on your health and your body, but there are also other effects opioid addiction can have on you, like it can affect your life, your relationships, your job, etc. People will also abuse Norco to get the high off of it as a party drug. So they can do that orally by taking the tablet, or they can snort or inject Norco. So I'm going to go over the consequences for each of those. If you are snorting Norco, it can be much easier to overdose, so it's very dangerous. It can also harm your nasal cavity. This means you can have reoccurring sinus infections, bloody noses. It can even affect your sense of smell. Consequences of injecting Norco are also it's much easier for your body to overdose because it's set right into your bloodstream. And just like any other intravenous drug use, there can be infections at the injection site, collapsed veins, and you're at a greater risk for HIV. The opioid epidemic is a huge issue in the United States, and in 2017, the Department of Health and Human Services actually declared the opioid crisis a public health emergency. Over 10 million people misused prescription opioids in the past year, as pointed out in this image to the left. Over 1 million people had an opioid use disorder. Over 70,000 people died from drug use. So this is clearly a very big issue in our country, and we are currently now taking steps to prevent this from happening, making it a little bit harder for doctors to prescribe this type of medication. And these are my references. Thank you so much for listening.